If you are over 60 and taking Amlodipine, Losartan, or Lisinopril for your blood pressure, I need you to stop scrolling and listen to me right now. That annoying cough that will not go away, those swollen ankles that make your shoes too tight, that dizziness every time you stand up too fast, it is not because you are getting older. It is not in your head. It is your medication. And your doctor probably never told you. What you learn in the next 30 minutes could change how you feel every single day for the rest of your life. Let me start with something very important. High blood pressure is called the silent killer for a reason. It damages your arteries, your heart, your brain, and your kidneys without making you feel anything at all. That is why taking medication for it is so important. These drugs save lives. They have saved millions of lives. I am not here to scare you into stopping your pills. In fact, nothing I say in this video is medical advice for your specific situation. You should never stop or change your blood pressure medication without talking to your doctor first. That could be very dangerous. But here's what I can do for you. I can tell you what many doctors forget to mention when they write that prescription. I can tell you what millions of seniors have learned the hard way. Their blood pressure medication works perfectly, but it comes with side effects that their doctor never warned them about. And because they did not know these side effects were caused by their pills, they suffered for months or even years without any relief. They bought special shoes for their swollen feet. They used cough drops every single night for years. They stopped going to family dinners because they felt dizzy and embarrassed. They thought they were just getting old. They thought they had to accept these problems as part of life. But that is not true. These problems have a cause. And in most cases, that cause is sitting right there in your daily pill bottle. So let me break down each of these 3 medications. They are all used for high blood pressure, but they work in completely different ways. They come from different classes of drugs, and they cause completely different side effects. Understanding the difference between them could change your life. Let me start with Lisinopril because this is the one that causes the most frustration for seniors. Lisinopril belongs to a class of drugs called ACE inhibitors. ACE stands for angiotensin-converting enzyme. This drug works by relaxing your blood vessels so blood can flow more easily. It is very effective at lowering blood pressure. Millions of people take it every day. But here is what many seniors do not know. Lisinopril causes a dry, hacking, persistent cough in about 20% of people who take it. That is 1 out of every 5 seniors. Think about that. In a room of 5 seniors taking Lisinopril, 1 of them will develop a cough that will not go away. And here's the cruel part. The cough does not start right away when you begin taking the pill. It can start weeks later. It can start months later. Sometimes it starts a full year after you have been taking the medication without any problem. So when the cough begins, you do not connect it to your blood pressure pill. You think you have allergies. You think you have a cold that never goes away. You think you have asthma. You try cough syrups, inhalers, allergy pills, everything you can find at the pharmacy. Nothing works. The cough just keeps going. And it is not a productive cough. You are not bringing up mucus or phlegm. It is a dry, hacking, irritating cough that feels like a tickle deep in your throat that you cannot satisfy. The cough from Lisinopril happens because the drug increases a substance in your body called bradykinin. Bradykinin irritates the nerves in your throat and your lungs. And for some seniors, this cough can be absolutely debilitating. They cannot finish a sentence without coughing. They cannot sleep through the night because as soon as they lie down, the cough gets worse. They cough so hard that they cannot catch their breath. Some seniors have even broken ribs from coughing so hard. Some have developed hernias. Some have lost control of their bladder. And the saddest part is that many doctors do not recognize this cough for what it is. Instead of switching the blood pressure medication, they prescribe stronger cough medicine. They send you for chest x-rays. They refer you to a lung specialist. They tell you to use an inhaler. All of this while the real cause is sitting in your pill bottle. So if you are taking Lisinopril and you have a dry cough that will not go away, especially one that gets worse when you lie down at night, that cough is almost certainly from your pill. The good news is that the solution is simple. You do not need another medicine. You do not need more tests. You need to ask your doctor to switch you to a different class of blood pressure medication. There are many other options that work just as well without causing that horrible cough. Now, let me talk about Losartan. Losartan belongs to a class of drugs called ARBs. ARB stands for angiotensin receptor blocker. Losartan works similarly to lisinopril, but through a different pathway in your body. The good news is that losartan almost never causes that dry cough. For seniors who cannot tolerate lisinopril because of the cough, losartan is often the perfect answer. But losartan has its own set of issues that many seniors do not know about. The most common problem with losartan is dizziness, especially when you stand up from sitting or lying down. There is a medical name for this. It is called orthostatic hypotension. Orthostatic means related to standing. Hypotension means low blood pressure. So orthostatic hypotension means your blood pressure drops too low when you stand up. Here is how it feels. You have been sitting in your favorite chair watching television. You stand up to go to the kitchen. Suddenly the room starts spinning. Your vision goes dark for a second or two. You grab the wall or the back of the chair to steady yourself. Your heart starts pounding. For a moment, you think you are having a stroke or a heart attack. It is terrifying. But what is really happening is that your blood pressure dropped too quickly when you stood up. Normally, when you stand, your body automatically tightens your blood vessels to keep blood flowing to your brain, but losartan relaxes your blood vessels. That is how it lowers your blood pressure, but sometimes it relaxes them too much. And when you stand up, your body cannot tighten them quickly enough. Blood pools in your legs. Your brain does not get enough oxygen for a few seconds, and you feel that horrible dizziness. This dizziness is dangerous not because of the feeling itself, but because it leads to falls. And falls in seniors are no joke. A fall can mean a broken hip. A broken hip can mean surgery. Surgery can mean a long hospital stay. A long hospital stay can mean losing your ability to live independently. All of this can start with a simple dizzy spell caused by your blood pressure pill. So, if you are taking losartan and you feel dizzy when you stand up, do not ignore it. Do not just accept it as part of getting older. Your dose might be too high, or you might need to take your pill at night instead of in the morning. When you take losartan at bedtime, the peak effect of the drug happens while you are sleeping. You are not standing up or walking around during that time. By the time you wake up in the morning, the strongest effect has passed, and you are less likely to feel dizzy. Another thing many seniors do not know about losartan is that it can increase your potassium levels. Potassium is a mineral that is essential for your heart to beat properly. Your nerves need potassium. Your muscles need potassium, but too much potassium can be just as dangerous as too little. High potassium, which doctors call hyperkalemia, can cause muscle weakness, numbness, or tingling in your hands and feet, and a slow or irregular heartbeat. In severe cases, it can cause a heart attack. This is especially a risk for seniors who have kidney problems, because your kidneys are responsible for removing excess potassium from your body. If your kidneys are not working perfectly, which is very common in seniors, and you take losartan, your potassium levels can creep up without you noticing. This is also a risk if you are taking other medications that raise potassium, like some diuretics or certain pain medications. And it is a risk if you eat a lot of high potassium foods like bananas, oranges, potatoes, spinach, tomatoes, and avocados. I am not telling you to stop eating these healthy foods. They are good for you. But if you are on losartan, you should have your potassium levels checked regularly with a simple blood test. And you should tell your doctor if you start feeling unusual muscle weakness, or if your heart ever feels like it is skipping beats or beating too slowly. Now let me talk about amlodipine. Amlodipine belongs to a class of drugs called calcium channel blockers. It works by relaxing the muscles in your blood vessel walls and by slowing down your heart rate slightly. Amlodipine is very popular because it works well and it does not cause that horrible cough like lisinopril. But amlodipine has a side effect that drives many seniors absolutely crazy. Swelling in the ankles and feet. This is not just a little puffiness at the end of a long day. This is significant swelling. Some seniors have swelling so bad that their shoes do not fit anymore. Their socks leave deep indentations around their ankles. Their feet look like they belong to someone twice their size. The swelling can be painful. The skin can feel tight and shiny. And here's what most doctors never tell you about this swelling. Diuretics, which are water pills like furosemide or hydrochlorothiazide, often do not work for this type of swelling. Your doctor might see your swollen ankles and prescribe a water pill. You take it, and nothing changes. The swelling does not go down. That is because the swelling from amlodipine is not caused by too much fluid in your body. It is caused by fluid that is in the wrong place. Amlodipine causes the tiny blood vessels in your lower legs to become leaky. Fluid seeps out of your blood vessels and into the surrounding tissue. Gravity pulls that fluid down to your feet and ankles. And once that fluid is outside your blood vessels, a water pill cannot remove it. The only real solutions for amlodipine swelling are to lower the dose, to switch to a different medication, or to add another medication that counters the swelling. Some doctors add a very small dose of Lisinopril or Losartan to help tighten up those leaky blood vessels. But many seniors suffer with this swelling for years without knowing it is caused by their pill. They buy compression socks. They elevate their feet every evening. They spend hundreds of dollars on special wide shoes. They miss out on walking and exercise because their feet hurt. And the whole time, the cause is sitting in their pill bottle. Another side effect of amlodipine that seniors do not know about is gum overgrowth. This is less common, but it does happen. The gums become thick, red, swollen, and tender. They bleed easily when you brush your teeth. They can even start to grow over your teeth. This is not a dental problem, it is a medication problem. And if your dentist tells you that you need gum surgery, you need to make sure your dentist knows you are taking amlodipine. Sometimes switching to a different blood pressure medication makes the gum problem disappear completely without any surgery. I have seen this happen. A senior is scheduled for expensive gum surgery. They switch from amlodipine to a different blood pressure pill. 6 months later, their gums are completely normal. No surgery needed. Now let me tell you about something that applies to all 3 of these medications, something that almost no one talks about. Dehydration. Seniors naturally feel less thirsty as they age. The signals from your body that tell your brain you are thirsty become weaker, so you drink less water than you need. You might go all morning with just a small cup of coffee. You might go all afternoon with nothing to drink. Then you take a blood pressure medication that lowers your blood pressure even further. The combination of dehydration and medication can cause your blood pressure to drop too low. You feel tired, you feel weak, you feel confused, you feel dizzy. You might even faint. And here is the dangerous part. Many seniors and even some doctors see that low blood pressure number and think it is good. Lower is better, right? Not always. For seniors, blood pressure that is too low can be just as dangerous as blood pressure that is too high. When your blood pressure is too low, not enough blood is getting to your brain. That is why you feel dizzy and confused. Not enough blood is getting to your kidneys. Over time, that can damage your kidneys. Not enough blood is getting to your heart. That can trigger chest pain or even a heart attack. So what is the right number for a senior? There is no single number that is perfect for everyone. But generally speaking, a systolic blood pressure, that is the top number between 120 and 130, is considered good. Below 110 can be too low for many seniors. Below 100 can be dangerous. If you are taking blood pressure medication and your top number is consistently below 110, you need to talk to your doctor about reducing your dose. You might feel better and still have excellent protection for your heart and brain. I want to tell you about something else that many seniors do not know. The time of day you take your blood pressure medication matters a lot. There was a large study called the Hygia chronotherapy trial. It followed thousands of patients for many years. The study found that taking your blood pressure medication at bedtime instead of in the morning significantly reduced the risk of heart attacks, strokes, and death. Why does this matter? Because your blood pressure naturally follows a daily rhythm. It drops while you sleep. For most people, the lowest blood pressure of the day happens around 3 in the morning. Then it starts to rise as you approach waking up. And when you wake up, your blood pressure surges. That morning surge is when most heart attacks and most strokes happen. If you take your blood pressure medication at bedtime, the peak effect of the drug happens exactly when you need it most, during that dangerous morning surge. Your blood pressure is kept under control at the time when your risk is highest. If you take your medication in the morning, the peak effect happens while you are awake and active. That is when you are moving around, standing up, walking. That is when you are most likely to feel dizzy and fall. So taking your pill at bedtime might not only protect your heart better, it might also reduce your risk of falls during the day. Of course, do not change the time you take your medication without talking to your doctor first. Different medications work differently. Some medications need to be taken in the morning for other reasons. But this is a conversation worth having with your doctor. Ask them, would it be better for me to take my blood pressure pill at bedtime? Another thing seniors need to know is that these blood pressure medications can interact with common over-the-counter drugs, things you buy at the pharmacy without a prescription. For example, taking ibuprofen, which you might know as Advil or Motrin, for arthritis pain can raise your blood pressure and make your medication less effective. Taking naproxen, which is Aleve, does the same thing. Even high doses of Tylenol can cause problems for your liver, especially if you drink alcohol. Taking antacids that contain calcium or magnesium can interfere with how your body absorbs amlodipine. Taking potassium supplements or using salt substitutes that contain potassium can be dangerous if you are on Losartan. Even natural supplements can cause problems. Licorice root can raise your blood pressure. St. John's wort can make your blood pressure medication less effective. Yohimbe can cause dangerous spikes in blood pressure. Always tell your doctor about every single pill you take. Prescription medications, over-the-counter pain relievers, vitamins, supplements, herbal teas, everything. Write down a list and bring it to every doctor visit. It could save your life. Now let me address something that might save your life right now. Many seniors stop taking their blood pressure medication because they do not like the side effects. They feel tired all the time, they feel dizzy, their feet are swollen. They have a cough that will not stop, so they skip a dose. Then they skip another dose. Then they stop completely, and they do not tell their doctor because they are embarrassed or because they think they know better than the doctor. This is extremely dangerous. When you stop taking blood pressure medication suddenly, your blood pressure can rebound to levels even higher than before you started. This is called rebound hypertension. Your blood vessels have gotten used to the medication. When you take it away, they clamp down hard. Your blood pressure can spike to dangerous levels. That spike can trigger a stroke or a heart attack within days. I have seen this happen. A senior feels fine for a few days after stopping their pills. They think they made the right decision. Then on day 4 or day 5, they wake up with a terrible headache. They cannot move one side of their body. They cannot speak clearly. They are having a stroke, all because they stopped their medication without talking to their doctor. If you are unhappy with your medication, do not stop it. Call your doctor. Tell them exactly what is bothering you. There are so many different blood pressure medications. There are ACE inhibitors like Lisinopril. There are ARBs like Losartan. There are calcium channel blockers like Amlodipine. There are beta blockers like metoprolol and atenolol. There are diuretics like hydrochlorothiazide and chlorthalidone. There are alpha blockers like doxazosin. There are central agonists like clonidine. There are direct vasodilators like hydralazine. If one medication gives you bad side effects, your doctor can find another one that works better for you. You do not have to suffer, and you do not have to risk your life by stopping your pills on your own. Let me give you a practical checklist that you can take to your next doctor visit. If you are taking Lisinopril and you have a dry cough that will not go away, tell your doctor. Ask about switching to Losartan or another ARB. The cough will almost always disappear within 1 to 2 weeks after stopping Lisinopril. If you are taking Losartan and you feel dizzy when you stand up, tell your doctor. Ask about taking your pill at bedtime instead of in the morning. Ask about lowering your dose. Ask about checking your potassium levels. If you are taking Amlodipine and your ankles are swollen, tell your doctor. Ask about adding a small dose of Lisinopril or Losartan to counter the swelling. Ask about lowering your Amlodipine dose. Ask about switching to a different calcium channel blocker like diltiazem or verapamil, which cause less swelling. If you are taking any blood pressure medication and you feel tired, weak, or confused all the time, get your blood pressure checked. It might be too low. If you are taking any blood pressure medication and you have muscle cramps, weakness, or an irregular heartbeat, get your potassium levels checked. And for all seniors on blood pressure medication, drink water throughout the day. Keep a water bottle next to your chair. Take small sips often. Stand up slowly from sitting or lying down. Count to 10 before you start walking. Check your blood pressure at home at different times of the day. Keep a log to show your doctor. And never ever stop your medication without talking to your doctor first. I want to share a story with you. Not a real patient name, but a story that happens thousands of times every day in doctors' offices all over the world. A 72-year-old man has been taking Lisinopril for 2 years. His blood pressure is perfectly controlled. But for the last 18 months, he has had a terrible dry cough. He cannot sleep through the night. He cannot finish a meal without coughing. His wife is exhausted from hearing him cough all night long. She sleeps in a different room. He has seen 3 different doctors. He has had chest x-rays. He has seen a lung specialist. He has tried 2 different inhalers. He has tried prescription cough medicine. Nothing works. He is miserable. He is starting to think he has lung cancer. Then a new doctor takes over his care. The new doctor looks at his medication list and says, "Let us try something simple. Stop the Lisinopril and switch to Losartan." The man is nervous. He has been taking Lisinopril for 2 years. His blood pressure is good. He does not want to mess that up. But the doctor explains that Losartan works just as well without the cough. The man agrees. He stops Lisinopril and starts Losartan. Within 1 week, the cough is completely gone. He sleeps through the night for the first time in 18 months. He eats dinner with his wife without coughing. He cries. Not because he is sad, because he had suffered for a year and a half. He had spent hundreds of dollars on doctors and medicines. He had missed family events because he was embarrassed by his coughing. He had worried that he was dying of cancer, and all of it was caused by a pill that his original doctor never warned him about. Do not let that be you. You do not have to suffer in silence. You do not have to accept side effects as just part of getting older. Blood pressure medications are supposed to make you healthier. They are supposed to add years to your life. They are supposed to let you enjoy time with your family without worrying about a heart attack or a stroke. But they are not supposed to make you miserable. If you are miserable, speak up, ask questions, get a second opinion. Switch medications if you need to. You have options. There are dozens of different blood pressure medications in different classes. Work with your doctor to find the one that controls your blood pressure without ruining your quality of life. Here is my final message to you. High blood pressure is a serious condition. It damages your arteries, your heart, your brain, and your kidneys. Taking medication for it is smart. It is protective. It adds years to your life. But the specific medication you take matters. The dose matters. The time of day you take it matters. What you eat and drink while taking it matters. Do not just swallow your pill every morning and hope for the best. Become an active partner in your own healthcare. Learn about your medications. Ask your doctor questions. Pay attention to how your body feels. If something does not feel right, do not ignore it. Write it down. Tell your doctor. If your doctor does not listen, find another doctor. You deserve to have a doctor who listens to you. You deserve to have your blood pressure controlled without suffering from side effects. You deserve to feel good while you are adding years to your life. So take your medication. But take the right medication at the right dose at the right time. And do not stop until you find the combination that works for you. Your heart will thank you. Your brain will thank you. Your kidneys will thank you. And your family will thank you for sticking around for many more years. You have survived this long. You have wisdom. You have experience. You have people who love you. Do not let a preventable side effect steal your joy. Do not let a medication that is supposed to help you make you miserable. Speak up. Take action. Get the right treatment for your body. You can do this. Now go call your doctor if you need to. And take care of yourself. You are worth it.